What are you hoping to achieve with this project?
So by 2022, we hope that we have delivered 15,000 polypharmacy medicine reviews. As well as that, we want to have trained a total of 120 healthcare professionals in polypharmacy medicine reviews as well. So this may be doctors, hospital doctors, GPs, other pharmacists, nurses. So that's an important outcome for this project, so that it's sustainable going forward, that we have an exit plan.
And how will you measure the outcomes of the project?
So in terms of the actual data collection that we're going to do, we are going to use some tools that we have used previously in the past, the Eden intervention scale, which essentially assigns a grade to the intervention that the pharmacist has performed. That allocates a grade to the intervention, which shows an improvement in patient care. Some of these interventions may be significant intervention, but don't really have that big a difference in the patient care itself. But the majority of interventions we have shown are grade 4 or above, which indicate that there is also an improvement to patient care, as well as the added benefit of providing a cost avoidance using the SHAR model, which highlights the economic benefit as well, which we know is also important going forward. We also are going to use a validated tool, the medication appropriateness index. Now, as part of this project, this tool has been adapted to include the person-centered element of this project as well. And members of the iSIMPATHY team have worked alongside the original author, Professor Joe Hanlon in America, to adapt this tool to make it a patient-centered tool that we can then use going forward. And finally, we are also going to ask for some prompts from the patient, so patient-reported outcome measures. And we hope to use an app that's been developed by the Scottish Government called Managing Your Medicines to identify improvements in the patient outcomes from their own point of view, pre and post review.
Thanks. That's really impressive. So what stage is the project at now? Have you started?
From, I think it was around February, we had all our pharmacists in post. So we have 10.5 project pharmacists working across the 3 jurisdictions. Certainly our 3 pharmacists have been in post since February and are out now currently delivering medicines reviews on the ward.
And finally, can you put the project into a broader perspective? Why is it worth doing?
So the goal is to produce a systems approach across health and care that is going to ensure the optimal and sustainable use of medicines for those with multi-morbidity to enable them to live active and healthy lives. So what we really mean by that is that we're adding quality added life years and not in poor health, so that you're adding quality to their life. And it's important for us because it forms part of the action plan here in Northern Ireland as directed by the Department of Health and our Health Board, and will also play a major contribution to the WHO's 3rd Global Health Challenge, which is to reduce the harm caused by medicines by 2023. But I think the person who can put it into the best, broader perspective is Joanne, because she has hands-on experience of delivering these reviews.
Well, we've had a number of patients who, whenever we ask them what are their concerns about their health or their medicines, you know, I'm taking too many. I don't know what all these medicines are for. Why do I need to take them? And they're so grateful whenever you go through and say, well, actually, we don't need this, or we don't need that, or perhaps we've identified treatment that's essential. You know, maybe a new patient where we started a statin, or you know, we started medication to help prevent future events. So patients are really, really grateful, and sometimes they may not have told their doctor something that they will tell the pharmacist, or we're getting to draw out other information that might be important. So, for example, patients that drink too much alcohol that nobody knew anything about, and things like that. But patients really appreciate, the hospitals are so busy, and they really appreciate being able to talk about themselves and their life and their health and their intentions for their health, and grateful for being signposted to other areas that may help them. So ultimately, the goal is for our patients to have greater ownership of their health and their medicines and improve their outcomes. So yeah, really worthwhile doing.
Thank you very much, Dr. Scullin, Dr. Brown. That was terrifically interesting.